Essential employees in the District, Maryland, and Virginia have begun receiving coronavirus vaccines. A group of representatives from the D.C. area have begun an effort to make it easier for federal employees to get shots sooner. Democratic Congressman Beyer represents Virginia's 8th District. He wrote a letter with 6 of his colleagues urging the Centers for Disease Control to create an allocation of vaccines for federal employees that the federal government would administer. Congressman, welcome. Thanks very much for coming on the program. How would this allocation work, and how would it get shots into arms of federal employees sooner?
Well, the key, Francis, is most folks, at least living in metropolitan Washington, have access to them slowly through the local governments, where they're titrated based on age and pre-existing condition. But we have so many federal employees that have not been classified as essential, but really are. For example, our poor IRS employees are responsible now not only for processing tax returns, but for getting checks out to all the folks through the relief packages. And those are all tricky things, and it's tough to do from home. Our Social Security people are incredibly overburdened, and often that has to be in person. They can't do it from home. And so we really need to make sure that these people are protected.
How much of the issue, in your view and in the view of your colleagues, Congressman, is that what you're describing there, and how much of it is the rollout of the shots in the greater metropolitan area? I don't have any visibility into the district on a personal basis. I live in Montgomery County, Maryland. There's a challenge there between what the county's doing versus the state. I know there are similar issues in your state of Virginia. How much of it's that versus what the federal employees are doing service-wise?
I think, Francis, that our state and local governments are all adapting as quickly as they can to understand how to do vaccine distribution at this level. It seems like if we look back to 2020, that the federal government did a good job supporting the rapid development of vaccines. I mean, faster than ever before, but spent almost no time thinking about how to get it into people's arms. I think the total amount spent by the federal government on vaccine preparation, administration, was like $6 million, almost nothing. So the dilemma is, though, that if you're a 50-year-old worker at the EPA or Department of Interior, you're not prioritized at all, even though the work you're doing is essential for the American people. So this is not a diss on local governments or state governments, but rather the recognition that you and I understand how essential these federal workers are for the good of the country, and therefore let's get them vaccinated as quickly as we can.
And regarding the operations at the state and local level, I don't mean to suggest that it's anything except tremendously complicated to do something of this scale. How would you like to see this work? Do you have an idea? Do you and your colleagues have an idea of who you want to administer it, where the allocations would come from, or is this just to the message to the CDC, it's time to get this started?
Well, I think the first thing is just to have the vaccines. As we've seen with local government, often they have very good systems set up and no vaccine to administer. So getting that special allocation, and now that President Biden is buying, hundreds of millions more, hopefully we can get that, but with the CDC's decision. And then in terms of the actual administration, I tend to leave that up to the various agencies and departments how best to make that happen. You can certainly imagine that, for example, the EPA would say, okay, everybody, this is the week for everyone to come down here and get your shot. You know where to park, you know which door works, you're surrounded by your friends, and then be ready to be coming back to work full time in a couple days.
What are you hearing from your constituents about their abilities to get vaccines and their desire for some type of a system like this, Congressman?
I'm finding enormous thirst for it. I don't know anybody in Northern Virginia, really metropolitan DC, that doesn't want the vaccine. And in fact, our constituent service phones are ringing off the hook with people saying, how can you move me up the list for this reason or for that? So I think there's a lot of enthusiasm for it. Anything that shortens the time between when you're vulnerable and when you get a vaccine is a good thing, especially because, Francis, as you know, there's a race now between our ability to vaccinate people and the arrival of this B117 UK variant. It's much more contagious. I don't know that it's more lethal, but if you're around it, you're a lot more likely to get it. And the way to minimize the spread of this new variant is to get people vaccinated.
Tony Reardon, the president of the National Treasury Employees Union, was on the program this week suggesting that federal employees should have administrative leave time to be able to go get vaccines. If your program if this program comes into existence, strikes me that might not even be necessary if people are actually going to their workplaces to get these vaccines, Congressman.
Francis, I think you're absolutely right. But I agree with Tony Reardon. In the meantime, it's essential that people have time to go, wait in line out at the government center in Fairfax or, wherever the big vaccine places are. I took my wife 2 Fridays ago, and it was a half-day journey to get out there, park, get in line, go through all the things, wait after you've gotten the shot. It was very efficient, but it still took half the day.
Mm-hmm. What response, if anything, have you gotten from the CDC? You and your colleagues sent this letter this week. Any word back yet?
We haven't yet, and I'm not bitter about that at all. I think they're pretty overwhelmed. I'm very excited about the new CDC director, Dr. Walensky. She seems to be a home run, and we're moving in the right direction.
We have less than a minute left, Congressman. What else would you watch as this as the vaccine rollout happens in the next couple of weeks as it pertains to the federal workforce, sir?
Francis, I think the biggest thing is to make sure that our federal workers, with all of us, realize that just getting the vaccine doesn't relieve us of the responsibility to protect everyone else. It looks like there's good news about transmission, but still, I've been vaccinated for a couple of weeks now, but I wear my mask everywhere outside. I try to stay socially distant. I try to stay as isolated as I can until we're all safe.
Congressman, thanks very much for joining me today.
Thank you, Francis, very much.